Dr. Bharata Pankania, a senior clinical lecturer at the University of Exeter Medical School. Dr. Pankania, thank you very much for your time, first of all. Now, there have been warnings of the grave danger of the spread of disease in Gaza for months now. Just how bad is it?
Well, whilst I don't know the picture in Gaza, talking empirically, the situation can get a lot worse depending on where the infection is. So in a place like war-torn Gaza, you would have contaminated water supplies. And when you have sewage mixing with a water supply, you're likely to get many gastrointestinal outbreaks. In a normal place, United Kingdom, Turkey, a gastrointestinal illness may not kill you. But when you are already vulnerable with starvation and undernutrition and poor nutrition, and then on top of that, you get a diarrheal illness, you can become very ill and you can die. And also you can get spread of infections like cholera, which come through contaminated water supplies. The other thing to bear in mind is it's not only water and water contamination, because land also may be contaminated with all manner of complex chemicals, further to them, these chemicals having been used in warfare.
And Dr. Pankania, aid agencies have been warning that Gaza's collapsed healthcare system could indeed kill more than the conflict itself, which we're at already 34,000 people dying in this conflict. Is that really possible from the spread of disease?
Well, indeed. So with the collapse of a healthcare system comes the collapse of that preventative measure that healthcare systems do, such as immunization and vaccination programs. So just imagine this. You've stopped giving measles vaccines, and then you've got a undernourished, poorly nourished young population, and measles is explosively infectious, then it would spread through like wildfire, and many of those people who would normally do okay following a measles infection would succumb because they were already in a poor state. So indeed, things like those are entirely possible if a population is not protected with preventative immunization programs.
Dr. Pankania, thank you very much for speaking to us this evening. Dr. Pankania speaking to us live there from Bath here in the UK.